Thank you. And first, let me say good morning and thanks to Ted and everyone at the network for bringing us back together again in order to make sure that we continue on this mission of creating supportive housing throughout New York State. It's also a pleasure to come together again with my colleagues at our sister agencies. You'll begin to hear some common themes, and I think that that is because of the great leadership that's been provided by our Governor Andrew Cuomo. He's always challenging us to do better. In tough times, we have to do better, sometimes with less. And the way that we've been able to achieve that is by working together. The Governor always challenges us to work outside of silos. So it gives us an opportunity to play to the strengths of our sister agencies. You know, our agencies, we're in charge of the brick and mortar. We build the building. But the programs we're not as familiar with, so we have to work in conjunction with our other agencies in order to make sure that on top of a safe, quality environment, that we also have those other supportive services. And we understand in order to make a dent in supportive housing, it has to be both. So sometimes we find ourselves having that conversation about this or that, but in this conversation, we certainly need to have the capital as well as those operation and support dollars as well. One of the other things that we've been able to achieve is through working outside of our silos has been to leverage our resources in order to make sure that we can get further. In 2013, Governor Cuomo announced the allocation of $86 million to support nearly 5,500 individuals through the Medicaid Redesign Team Supportive Housing Program. And the funds are managed by multiple state agencies working cooperatively and support both capital projects and rental and service subsidies. To date, HCR funds has been committed to construct 12 new buildings, which will create 483 new supportive housing units. So it shows the aggressive approach that the governor has challenged all of us to achieve. Additionally, on top of those mandates, we are also, through our partnership with a number of you in this room, are developing innovations in order to provide those services in a better way, whether it is mixed developments or the utilization and infusing of technology. Those ideas are coming from you in regard to how we can better work to provide services for this vulnerable population, which includes people who have challenges with homelessness, folks with health and mental health issues, as well as folks who are dealing with the recovery of substance. So it's an interesting and challenging time to be involved in this area. We too were excited about the conversation, or at least the fact that as we move on to have conversations with the legislature in regard to the J.P. Morgan Chase settlement, that the beginnings of the conversation for New York 4, urban New York, are taking place. We've seen the types of achievements that we've been able to make in the city of New York, and think that we could achieve some of those same successes throughout the rest of the state of New York. So, you know, we will continue to work with our partners, both governmental as well as private side and not-for-profits, in order to achieve these tremendous goals that have been set forth by the governor. Bill talked about the governor's leadership, and I think that part of his leadership is that he's a good listener. And of course, you know that supportive housing business is not anything that's new to the governor. He cut his teeth sitting in this room probably a number of years ago, also putting some of the protocols together. So it's an area that he's very, very familiar with and is challenging us to meet these great goals. And we look forward to continuing to work with all of you in order to meet those goals.
Thank you. And Kristin.
Thank you, Bill. Good morning, everyone. I'd like to start by thanking each and every one of you for the work that you're doing day in and day out in the field. Certainly the collaboration that you're hearing about this morning between state agencies is an important part of the provision and development of supportive housing throughout New York State, certainly in the city, but really in every part of New York State now. We're seeing an increased focus on and increased resources for supportive housing. But really, it's not without your partnership in the not-for-profit sector and in the private housing development sector that this could be possible. It's really you day in and day out helping us to develop the units and helping us to make sure that those units are appropriately operating and that the populations that most need the supportive services that those housing units can provide, that's really where the job gets done. So thank you very much for your ongoing commitment and partnership to this work. I think all of you know very well that homelessness is an issue that really cuts across populations. It cuts across geography in this state. I think that's certainly something that we all felt, if not before the Great Recession of several years ago. It's something that certainly emerged in parts of the state that even had not experienced it before. And that's why those partnerships that you're hearing about today among the state agencies and the city agencies as well that you heard about in the opening session this morning, and your partnership and commitment is that much more important. I think given the high cost of housing in New York State, and that's a trend that I don't think any of us believe will change anytime soon, many more low-income individuals and families are at risk of losing their housing. A lot of these individuals and families are also at the same time that they're grappling with the economic realities of the housing market and their employment situations. They're also dealing with an array of other issues such as mental illness, chemical dependency, HIV/AIDS, or other chronic diseases that puts them not only at a greater risk of becoming homeless, but for those who are already homeless makes it even more challenging to be able to find transitional and permanent housing opportunities. We also have those youth who are aging out of foster care, and many individuals, men and women, who have so proudly and nobly served our country in the armed forces, who are returning stateside and who are looking for housing resources as well. And so many of them, unfortunately, struggle with many issues themselves, whether it's post-traumatic stress disorder, traumatic brain injury, substance abuse, and that makes their return to the States and their re-entry into civilian life from the military that much more challenging. So that's a population that we're particularly focused on at this point in time as well. Our goal at OTDA, for those of you who are not familiar with the State Office of Temporary and Disability Assistance, which is a piece of what now a number of years ago was the State Department of Social Services, really is to try to address and help the counties and New York City address the housing needs of the lowest income New Yorkers, in full recognition that housing stability is an essential foundation to treating the array of other issues that I mentioned earlier. And it's a key element to helping people become stable and prepare for employment so that they can achieve eventual self-sufficiency. We also recognize that a number of homeless individuals and families, because of the array of challenges that they face, really need supportive housing in order to make that transition and may need supporting housing resources for the foreseeable future. One prime example of OTDA's involvement in the MRT work that you've heard my colleagues describe earlier in this panel really has to do with collaborating with the other agencies on program development, on service coordination, on data collection and performance measurement. And really, I think for all of us, data collection and performance measurement sometimes is easy to lose focus on in the day-to-day work that we have to do to develop units, to operate units, and to provide the supportive services that are so essential for people transitioning from homelessness and from homeless shelters into stable housing arrangements. But it really, from my perspective, is a particularly critical element. There are lots of wonderful anecdotes, and we hear lots of them at conferences like this, and that's truly terrific, and those are examples of lives that have been profoundly touched and turned around by the work of providers who are in the supportive housing business. But being able to have sound data and a rich set of data to use to demonstrate to federal agencies, for example, in our never-ending quest to secure more federal resources for New York State and its various housing programs is particularly important. And so I would encourage all of you, as you're continuing your day-to-day work, to think about how you can begin to focus a little bit more on robust data collection efforts and performance measurement, because that information really helps us not only to inform our work and where to focus resources, but really also will help us to be able to state the case on behalf of all of you, to be able to further your efforts by securing additional resources, whether they are resources from the federal government, potentially resources through private investment if we are successful going forward in securing state authorization for the social impact bond model that you heard Deputy Director of State Operations Fran Ryder describe earlier. And so I really would encourage you in that area. Over the many years now that OTDA has been administering the state's Homeless Housing and Assistance Program, which is a capital program, there have been over 14,000 units of housing developed in every corner of the state, and we're approaching 15,000 units developed in over 600 projects. The projects are really so diverse. It's absolutely fascinating. They're diverse not only in a place like New York City, that is in and of itself an extraordinarily diverse place, but they are very different, yet have the same core similarities in every corner of the state. And I think we've been seeing at OTDA an increasing interest and response to our homeless housing and assistance program from upstate communities as well, which was not necessarily the case in the earlier days of the program, but certainly is becoming the case more and more. And so we are seeing different models emerge. In some communities, for example, particularly in rural communities, you don't see large apartment buildings like you would see in a more urban setting, be it in New York City or one of our upstate urban cities. And so instead, HHAP has the flexibility to be able to fund single-family residences or small apartment buildings if that's sort of what fits in with the community landscape. And I think that's a particularly important aspect of our homeless housing and assistance program, because it does enable developers and providers to have the flexibility to develop units that will not only meet the needs of the population to which they're targeted, but that will also fit in the community landscape. And I think that's an important piece of integration and true involvement, as Bob said, in the community that we all collectively strive toward. I will end by providing some additional good news. It was touched upon in the plenary session this morning, but this year in the state fiscal year 2014 enacted budget, which took effect on April 1st, HHAP saw the first increase in its funding level in about 19 years. It's been funded at $30 million, which is a nice amount of capital funding, but it's been consistent for all of those years. And thanks to the governor's leadership and the support and cooperation of the state legislature, we have $63 million this year. We released an RFPs last Friday, May 30th. There will be a webinar on Tuesday morning coming up, and then that will be recorded and will be available on our website for those of you who either can't view it live on Tuesday or who love it so much that you want to watch it over and over and over again. But HHAP really is a fantastic opportunity and does provide great flexibility in the kinds of proposals that can be developed. We will begin accepting applications on June 30th. My sense is that there are already a lot of interested parties that were sort of pre-drafting their proposals before the RFP was officially released last Friday, since the news about the significant increase has been out there since April 1st. But I really am looking forward, as the chair of the corporation that administers HHAP, I'm looking forward to seeing the proposals that come in and really to the difference that enormous increase in resources will be able to provide in every corner of the state. So I thank you again truly for your partnership, and I look forward to the rest of the time with you.